Thanks for coming, everybody. My name is Dr. Tanya Adams. I am a board member of Doctors for Cannabis Regulation, and I'm actually one of the founding members. I joined in 2016 when DFCR was first started, and we're a group of not only physicians, but we are physicians, and we also have attorneys, nurses, other medical community members, and people that are just supporting medical cannabis and cannabis use with regulations that will allow people to use cannabis safely. And I find it a really dynamic group of people to work with. I'm really grateful to be a member of this group. And we are joining today with Marijuana Matters to bring you this webinar, Cannabis and Women's Health. And I'm really happy to have this as an interesting topic. And I hope everybody joins DFCR. You're more than welcome to join. Membership is free. And we will have links for joining. We hope that everybody will be happy to join. And now we're really excited. DFCR is happy to partner with Marijuana Matters to bring the webinar to you. And I'm happy to introduce Courtney. She is who will give you an overview of Marijuana Matters. Courtney.
Thank you so much, Tanya. And welcome everyone to this webinar. As Tanya mentioned, my name is Courtney Davis, and I am the Executive Director of Marijuana Matters. We are a social enterprise organization that works to repair the harms from the war on drugs. We do this work through education, advocacy, and entrepreneurship support. And we are thrilled to co-host this panel with Doctors for Cannabis Regulation. And although our organization isn't focused on healthcare, we believe that healthcare professionals and clinical research are a vital part of destigmatizing the plant, which we believe will lead to creating a safe and equitable and resilient regulatory scheme for the legal cannabis industry in this country, especially research that can help underserved populations. So I'm really honored to be co-hosting this event with you all. We have 3 phenomenal speakers, so I am not going to take up a lot of time, but you can visit our website at marijuanamatters.org to learn more about the awesome work that we do or any other events that we have upcoming. And I'm excited to be closing out Women's Healthcare Month with DFCR. I have the pleasure of introducing our first speaker. Dr. Leslie Mendoza Temple is the Medical Director of the NorthShore Integrative Medicine Program, DFCR Expert, and a board-certified family and integrative medicine physician. She also serves on the Medical Cannabis Advisory Board for the Illinois Department of Public Health. Dr. Temple combines the tools of modern Western medicine with safe, evidence-based, complementary, and alternative medicine, including cannabis, to achieve optimal health and symptom reduction. Dr. Temple will be speaking on managing premenopausal and PMS symptoms with cannabinoids.
Thank you for joining us this evening. I decided to tackle a hairy one because it's perimenopause and PMS. And so my disclosures are that I am on the Scientific Advisory Board for Ashford International, which looks at testing CBD hemp products for quality and purity. So, but I won't be discussing any of those products today. And I'm a female with mild perimenopausal symptoms, ask my husband. I wanted to give, since I'm the first speaker, I thought it'd be good to do a Women's Reproductive Hormones 101 and talk about what happens in the typical menstrual cycle for a female human. So we start with our day 0 is the first day you start bleeding, and then your ovary, this little ovary right here, starts to ripen an egg slowly, 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 and then eventually the ripened egg comes out. You ovulate, and then if fertilization occurs with egg meeting sperm, then the fertilized egg then implants into the uterus, and then you have a pregnancy. While the ovary, that part of the egg that was ripened, that little house for it, becomes the corpus luteum, and starts to secrete other hormones. And so during ovulation, you get that egg release. You have estrogen that ripens the egg is released. And then as time goes by, progesterone builds up, getting ready for a potential fertilization event. And so the progesterone helps with maintaining the pregnancy. And every month, a woman is born with a certain number of eggs in her. I call it the egg factory, the huevo factory. And month after month, if it's a regular period, you cycle and cycle till about the average age of about 51, when women go through and the ovaries decide to retire. The eggs run out. Maybe there'll be a few cycles that don't actually have an ovulation event, and the hormones can go a little wackadoo. So you've got this hormonal cascade that happens month after month, year after year, and decade after decade. Now, when it comes to interesting things I found with the cannabinoid system, when I was doing some research for this talk, you've got anandamide peaks that happen at ovulation, and your endocannabinoid system is involved in every cellular process. So I thought that was really interesting. Anandamide is the bliss hormone, and if you think about ovulation, it's part of the propagation of our species. And so in ovulation, usually the female animal is in the mood and ready to reproduce. And so the egg is ready, the male is ready at any time, sperm happens, they come together, and then you've got a fertilized egg. So that is really kind of the evolutionary biological explanation. And every month this happens, and it's normal to go into a menopausal state where at some point, this is such a sad slide because I'm on the right side of this, but in a younger premenopausal vagina, you've got these nice and plump and pink and young, young everything. And as time goes by, as the estrogen hormone inputs decline, the walls of the vagina get thinner. They actually look paler, even shortens a little bit. And so symptoms can come about. It's normal to go into this. This is just part of the cycle of life, but symptoms like vaginal dryness, painful intercourse, decreased libido, hot flashes, night sweats, those are things that can happen as a normal course in our reproductive life. And when you compare what's the difference between PMS and menopause, PMS is a period of time, usually about a week before the period bleeding happens, where a bunch of symptoms happen, and then the bleeding occurs, and then shortly thereafter, the symptoms go away, and then they repeat again. And some women have very short little PMS symptoms, like for 3 days, but some can have it for 7 days. Some even have it for 2 weeks. And so just depending that you saw what happens with those hormones, in menopause, you can have very similar things with fatigue, insomnia, changes in sexual interest, cravings, psychologic symptoms can run the gamut, being cranky, tearful, forgetful, restless, lonely, depressed, confused. In menopause, we find a lot of overlap there. But in menopause, these symptoms can persist because there's no more cycling of your period. And then the physical stuff that can happen with breast changes, back pain, bloating, those are classic of PMS, menstrual cramps, water retention. And the physical symptoms for menopause add to that: hot flashes, night sweats, painful sex. You saw why with the changes in the vaginal canal. You can get your recurrent urinary tract infections because the estrogen isn't supporting the tissues as well, and bacteria can sweep into the urethra. It's common to happen there. And then bone density can go down as well as estrogen levels decline naturally. So lots of overlap here. And we found that women who tend to have rougher PMS symptoms can tend to have rougher menopause symptoms. Some women are very lucky and they kind of slide through life, and they're not on this talk right now, I'll bet, or maybe not. So hopefully if you are a practitioner or a provider, I think it helps to explain the hormonal cascade, and that these things are just normal events, but that some women are more sensitive to these changes than others. So bringing this to the endocannabinoid system, we've got internal functions. What is this system for? It's our built-in mechanisms to help us relax, eat, driving appetite, to help us sleep, protect ourselves from illness from an immune standpoint, and to forget pain or forget stresses. So this is part of life. It helps us survive moment to moment. We don't always have to relax. So when it's time to relax, you get a little blush of the right endocannabinoids to induce that sensation. When it's time to eat, then the appetite stuff comes up and your body knows what it needs at the precise moment. So a fully functioning endocannabinoid system will help you remain balanced. And Jen Esther is going to talk about endometriosis and how that system gets disrupted. But imagine any disruptions in relaxing, eating, sleeping, immune system, and forgetting pain can cause all kinds of issues. But focusing on this in female hormones, I mentioned earlier that the ovary produces anandamide, or the bliss endocannabinoid. I showed you how it peaks when we ovulate, and it goes up with estrogen levels. And so when estrogen levels go down, anandamide may go down, but it suggests that estrogen really has a controlling factor with how much endocannabinoid we produce. When we give endocannabinoids, it's been demonstrated that it relaxes your blood vessels, so that perhaps it may be useful for treating hot flashes, or we call them vasomotor symptoms. So I think that's interesting. I have had a few patients tell me that the cannabis helped their hot flashes. Not always. I'm going to talk about some integrative therapies too that help in the end. But I thought that was interesting that we've got some mechanisms in our body that may explain why cannabis works for various issues. And then again, because I'm going first, it's just the anatomy of the cannabis plant. I know we have a lot of experts here. One thing I thought was really interesting is that everybody seems to know about CBD and THC, but we also have CBN, CBG, THCA, so many other cannabinoids. In fact, as of the count, it's 120 cannabinoids. We still have a lot to learn about. 110 terpenes and other phytochemicals as well. So the cannabis plant is very complex. From plant to plant, it's different, and how it acts in person to person is very different. So makes it difficult to study, makes it difficult to make like generic suggestions. Like I cannot say, here's the magic cannabis for hot flashes. Everyone should take this. That you can't do that, because what works for one person may be too strong for another. So it is still, even after certifying 700 people in my practice, I still don't have a magic, here, use this, everybody. I would say go low and slow has remained the mantra, but for the most part, everybody has to keep trying it in little bits and figure out what they like. So various forms of cannabis come in the lung form, so inhaling through flower, smoking flower, vaping oils and concentrates, here to the edible formulas, which of course can come in food, in candies, in pills. There's no picture, I can't see all the slides here, but topicals, rectal suppositories, vaginal suppositories. I'd say find a route, you can get it somehow in your bloodstream and it will go. And have different effects depending on how much you took and your personal constitution and the cannabis itself. So when I was looking for research on how does cannabis help PMS and menopause, women's symptoms, all I could find were surveys. Researchers asking women a bunch of questions and having them report back what they thought. So I haven't seen any like solid randomized controlled trials where you have a placebo group here and you have a group getting real cannabis and then comparing, where we have so many challenges in research right now. Hopefully that will change in the future. But right now we got surveys, and the greatest expectancies on one of the surveys in 2016 were they asked women, what do you think cannabis will do for menopause? And so these are the symptoms. Well, for those on the phone, it's to help ease joint and muscle discomfort and irritability, sleep problems, depression, anxiety, and hot flashes. And then another survey, this one is recent. This was interesting because this actually applies to our talk today. It was a pretty homogeneous group of mostly white, college level educated, perimenopausal, postmenopausal women, pretty decent number of people, 258. And they mentioned that the most common methods of using it were smoking and then edibles. The top 3 symptoms that it seemed to treat in this group they surveyed was sleep, mood, and libido. Hot flashes were actually at the bottom of the list, which I thought was interesting. It kind of mirrors what my practice is. So I would say I agree, sleep, mood, and I haven't really had patients report the libido factor, but I thought that was interesting. So I dived further into that and found quite a bit of research showing that, and especially I would say in menopause, when the drive to procreate is down, and so many reasons why libido goes down. It's not just a body thing, it's a mind thing, relationship, psychology, culture. But when evaluating sexual pleasure, most studies show that cannabis had a positive effect, as long as it was in a low dose. So interestingly, not only did it seem to help with just sex in general, but it was the quality of the sex, prolonging orgasm, improving the experience. But if the doses were too high, like 4 or more joints, for instance, that it actually inhibited sexual desire and probably just put the person to sleep. So low doses of cannabis were associated with the better experience at 1 joint, I guess, per day or per experience. And the limitations of this research are that when you talk to patients with surveys, there's recall bias. You have to rely on memories. You're also interviewing an interested cohort, so you may get skewed results. And we, again, need RCTs, randomized controlled trials, to see how this works and compare it to maybe other medications, for instance. So, quote, "It's therefore difficult to make broad generalizations about the effects of cannabis on female sexual function based on available evidence." But we're in that, let's talk in 10 years. I hope that changes. And so cannabis is not a cure-all, and sexuality is complex. The endocannabinoid system is only one small part of it. I thought it was interesting to see. And then I can't do a presentation without presenting the dark side of cannabis, which can have side effects, particularly cannabis hyperemesis syndrome and cannabis use disorder. Those things happen, maybe inflated in certain places, but we have to respect it. These things can happen, as well as promoting, dopamine release helps promote the pleasure and reward centers. So I think that's a nice side effect. My timer is off, and so I am at 14 minutes. The other things that can happen is just be careful with children in the house, because the amount of hospital or ER visits to patients' homes that have cannabis in it have increased with kids getting into the stuff. So lock it up. And I think at that point, here we go. People ask about what are the lifetime dependence risks. We have nicotine, heroin, and cocaine, and alcohol is much higher, but cannabis is still not. It has a potential for addiction of about 9%. My integrative approaches for managing PMS, I'll just throw this slide out. You might want to screenshot this, but oral contraceptives, calcium and magnesium supplementation may help. Chasteberry tree extract, a favorite herb of mine. Eating saffron in tea or in food. Definitely look at acupuncture and Chinese herbs, plus minus, depending on your meds. And mind-body therapies to help calm the nervous system down. Thoughtful scheduling. If you know Hell Week is coming, then don't schedule some big presentation or trip if you can help it for the PMS part. And for menopause, hormone replacement therapy is the gold standard, but it's not for everyone because it has risks. Again, acupuncture, Chinese herbs, mind-body therapies. I like black cohosh, works in about maybe 50% of my patients. And eating a whole foods soy servings, tofu and edamame are the best. Limit alcohol, sugar, and processed foods. And then eat your vitamins. Try to get everything from plants as much as possible. Do a good job 80% of the time. So you don't have to be pro-marijuana to oppose its prohibition, which is lots of double negatives in there. But I want to thank Doctors for Cannabis Regulation for inviting me to speak and for being such a platform for common sense legislation. And this is my team. We're in Glenview, Illinois, and happy to have been part of this. Thank you so much.
Thank you, Dr. Temple. I know I learned a lot. I always love being a part of hosting these types of events, because even if even after having been in the industry for a while, you are always learning. And that's what I think one of the reasons why a lot of people are interested in the cannabis is because there is so much potential for us to learn. And I like your comment about, let's see where we are in 10 years. So thank you so much. I'm now going to introduce our next speaker, Dr. Felicia Dawson. She has practiced holistic gynecology, integrative and functional medicine for over 30 years and was recognized as one of the leading female obstetrician gynecologists in the nation. She now focuses full-time on advocating, educating, and consulting on medical cannabis, working with multiple grassroots organizations to decriminalize this amazing plant that has been used for millennia by humans as food, medicine, fiber, and more. Dr. Dawson will be speaking on CBD in pregnancy.
Thank you, Courtney. Doctors for Cannabis Regulation and Marijuana Matters. I am an advisory board member of Cannabis, which is an incubator company for small businesses launching in the cannabis space. Cannabidiol, also known as CBD, is the most abundant phytocannabinoid in cannabis and hemp. By definition, hemp is less than 0.3% THC in America. It is non-intoxicating. It exists in the raw plant, primarily in the form of cannabidiolic acid. Time, heat, or oxygen can decarboxylate it and turns it into CBD. Thank you, Dr. Temple, for that incredible introduction to the endocannabinoid system and cannabis. CBD works by interacting with this endocannabinoid system. The endocannabinoid system is throughout our bodies, every organ, including our skin. And because it interacts with so many different types of receptors, it has a wide-ranging gallery of actions. Everything from decreasing cravings and addiction to decreasing anxiety and depression, fighting cancer cells, removing amyloid plaque, which is present in Alzheimer's, and decreasing seizures. I have highlighted in red those actions that are commonly sought after by individuals who are pregnant. Pregnancy is an amazing time. Your body is going through some amazing changes physiologically and emotionally. Stress, anxiety, depression, nausea, vomiting, pain, insomnia are all common challenges of pregnancy. Hyperemesis gravidarum is the most severe form of nausea and vomiting. It can happen in up to 3% of pregnancies, and it can result in hospitalization, the need for IV hydration, pharmaceuticals to decrease your nausea, and in some cases, intravenous nutrition. CBD is well tolerated. Very few people have side effects under 1,500 milligrams per day. The typical person is taking maybe 600 milligrams at the most or less. Some individuals are sensitive to CBD and they may experience changes in appetite or weight, sedation or fatigue, or diarrhea. If you are on a medication that warns you against ingesting grapefruit juice, that means that your medication and CBD may compete with each other for the enzymes that break them down in the liver. And you may need to have your levels of these medications follow more closely if you're taking things like blood thinners or seizure medications. But again, drug to herb interactions are very rare under 1,500 milligrams a day. This slide is more for those healthcare providers who may be in the audience, eye candy for them. I only have 3 things to say about this slide. Number one, there are no studies on CBD in pregnancy which involve human beings. The research we have is primarily preclinical, as in test tubes, cells, animals. Number two, the source of CBD matters, whether it's synthetic versus botanical. It also matters if it's whole plant extract versus isolate. And lastly, I want to point out that most of the research involves giving supraphysiologic doses of CBD, as in this case here, a study from 1986, adult female mice were given 50 milligrams per kilogram of CBD, and their male offspring had a decrease in sperm count. And this study is cited to this day by the FDA. 50 milligrams per kilogram is more than twice the maximum dosage of the only FDA-approved CBD isolate we have, called Epidiolex, to treat seizures. The maximum dose is 20 milligrams per kilogram, and yet female mice are being given 50 milligrams per kilogram. I say the synthetic cannabinoids versus those derived from the plant differ because, well, at the receptor level, they may perform similarly, but that's not the whole story. Typically, synthetics will bind to the receptor a little more tightly, but in the case of CBD, its metabolism is much more complex than that of THC. Over 100 metabolites have been identified for CBD, unlike THC. And CBD derived from the plant and its metabolites have a very low affinity for the cannabinoid receptors 1 and 2. Synthetic CBD, however, metabolites have a moderate to high affinity for receptors. That means they bind more tightly and for longer to the receptors, which can result in unexpected biological actions. It also makes a difference when you're dealing with the whole plant extract versus an isolated molecule. The entourage effect has morphed into this concept where 1 + 1 + 1 does not equal 3, it equals 10, because the synergy of multiple molecules coming together allow us to treat with a lower dose of the plant, versus isolated molecules require higher doses just to get the same effect. And when you go up higher, you will tend to get more side effects. Remember the adage that the difference between a medicine and a poison is the dose. CBD interferes with THC's ability to bind to the cannabinoid receptor, which may blunt some of its effect on the pulse rate, for example. What other built-in safety features are we losing by reducing the plant to its individual components? Let me be clear, CBD is discouraged during pregnancy and breastfeeding by the FDA, the American Academy of Pediatrics, and the American College of Obstetricians and Gynecologists. However, hemp seeds are okay. Hemp seeds are an excellent source of protein, and they have the optimal ratio of omega-6s to omega-3s, which are the building blocks of the endocannabinoids that our bodies produce, as well as our cell membranes. CBD has not been used historically as a single molecule. Women have used the whole plant for thousands of years. Actually, the term of cannabis and hemp have been used interchangeably throughout history. Women have used the whole plant before, during, and after pregnancy in the form of tinctures, topicals, suppositories, as well as inhalation methods. We need meaningful research with the whole plant in human beings. Until then, we want to decrease risk. The number one pregnancy-associated cause of death is homicide. Next up are mental conditions which result in suicide or overdose. Then we have hemorrhage, infection, and heart conditions. as contributing to the deaths of pregnant individuals. It is so important to talk to someone if you're struggling with a mental disorder. Your providers can give you a referral to a mental health specialist. If you're in an abusive relationship, there are domestic violence shelters that you can reach out to, crisis lines, support groups. Since COVID, mental health services are coming online, and most hospitals have helplines which can help you know what resources are available in your area. The American College of Obstetricians and Gynecologists realized way back in 2004 that we live in an environment full of toxins, which have negative effects on our health as well as those of our unborn children. The Environmental Working Group is a wonderful resource to give you products and make suggestions regarding foods to decrease your exposure to toxins. You want to eat organic food if you can afford it. Drink filtered water so you can decrease your exposure to forever chemicals. Breathe clean air. I have an air cleaner in my office as well as my bedroom. Sleep is such an underrated health tool. We detox and repair our bodies during sleep, especially the brain. Do your best to manage your stress by using meditation, yoga, journaling. Getting out in nature is free and is so health promoting. Avoid as many pharmaceuticals and drugs as you can, including alcohol and tobacco. Make use of aromatherapy. Essential oils are terpenes, which are present in cannabis and hemp. Lavender and vanilla are very calming. Bitter orange and clary sage can help with pain relief. There are multiple botanicals that can help with nausea and vomiting. Ginger is the most researched botanical in nausea and vomiting in pregnancy, up to 1 gram a day. Peppermint, spearmint, lemon balm, all can help. Body work is very helpful with decreasing stress, as well as improving your endocannabinoid tone. Acupuncture, osteopathy, massage are all great. There's only one pharmaceutical approved for nausea and vomiting in pregnancy. It's a combination antihistamine and vitamin B6. If you choose to use CBD, and I acknowledge that not everyone has the finances or time to implement the tips I've given thus far, if you choose to use CBD, please know that cannabis and hemp are bioaccumulators. They draw in toxins from the air, water, and soil. So you want your CBD to come from a plant that was grown organically. Choose a full or broad spectrum product so you have the full range of cannabinoids and terpenes and flavonoids, so you can use the lowest dose that will take care of your symptoms. If you have a job that you get tested for THC, you might want to choose a broad spectrum product, which does not have any THC. Unlike the cannabis market, which is highly regulated, CBD is not regulated at all. You should make sure your product is third-party tested. It should have a QR code on it that tests for heavy metals,
I was telling you, I
mold.
talked to Bob Chuck for an hour today.
Heavy metals, mold, bacteria, and residual solvents. Use a healthy way to administer your CBD. If you're nauseous, you're not going to want to take anything by mouth, probably. And that's the case for electronic vaporizer made especially for dry flower. That will minimize the generation of combustion toxins like carbon monoxide, ammonia, tar. CBD is also available in tinctures. You can also add CBD to your favorite tea, or you can make hemp tea from flower. Topicals should have at least 2% CBD by weight. Vaginal suppositories, and there are a multitude of bath products because, as I said, your skin also is covered with cannabinoid receptors. Electronic cigarettes and vape pens are discouraged for several reasons. One of them would be the metal inside of the cartridges, when they become heated, can leach heavy metals into your oil. Twice a day dosing works for most people. And if you take your CBD product after a meal containing fat, that will increase your absorption up to 5 times. We need more meaningful research, exhaust all holistic measures to have a pleasant and safe pregnancy, choose the safest method and of a CBD product and delivery method. Thank you.
Next, I would like to introduce our next speaker, Dr. Janester Wilson-King. She's a board certified OBGYN and DFCR board member and expert. After years of providing full service OBGYN care, she founded the Victory Rejuvenation Center, which is a private, holistic, and integrative wellness medicine practice that offers life-transforming management modalities to customize medicines for patients. And she's the vice president of the Society of Cannabis Clinicians, which is a nonprofit that works to empower and educate healthcare providers of cannabis medicine. And she is also on the special advisory board for the Association of Cannabis Health Equity and Medicine, ACAM. Dr. Wilson-King is an expert on cannabis use in women's health conditions and experienced experienced cannabis clinician for adults and a master in hormone therapy. And Dr. Janester King will be speaking to us regarding endometriosis, a clinical endocannabinoid deficiency condition. Dr. Wilson-King.
Awesome. Thank you. It is an honor to be here. Thank you to Marijuana Matters, Doctors for Cannabis Regulation, and everybody that went into putting this together. I have the distinct pleasure of following 2 amazing presenters, Dr. Leslie Templeton and Dr. Felicia Dawson. And hopefully I can measure up to what they have said. I always start with my mantra, which is the health of many people with reproductive tracts that consist of a uterus, tubes, and ovaries, and the commonly associated hormones, has multifactorial components, including mood, pain, poor sleep, and/or hormonal dysfunction. The capacity of cannabis to act as an anti-inflammatory agent, a muscle relaxant, a mood enhancer, a sleep remedy, and a pain reliever, all at the same time, make it ideal for those facing these health conditions. I've always said to patients that cannabis was made for women and their conditions, and cannabis is a female. So of course it should work for women. So here we go with that. I will talk to you tonight about, very briefly, there's only so much you can do in 15 minutes, but I'm going to try to get some points in, as well as my other colleagues have done. I'm going to tell you what endometriosis is, the signs and symptoms, current treatment modalities, is it a clinical endocannabinoid deficiency condition, and some current delivery methods which you can use to treat your cannabis, and then I'll close with some final points. What is endometriosis? Endometriosis is defined as the presence of endometrial tissue. I have to get this out of my way. Endometrial tissue outside the uterus. The inner lining of the uterus is called the endometrium. And when it gets displaced anywhere other than its normal location is called endometriosis. Now, the tissue that is mislocated is accompanied by a chronic inflammatory reaction that, because it's out of place, that tissue is responding to hormones, as Dr. Leslie so brilliantly described, the hormonal fluctuations. When that estrogen level is elevated, it stimulates the endometrium, which is the lining of the uterus, which she explained to you. But when that tissue is displaced, either in the wall of the uterus or wherever else in the body, it still responds to hormones, and it causes a chronic inflammatory reaction for 2 reasons. 1, because of the hormones, and 2, because it's located in a position where it should not be. Now, the prevalence of endometriosis is about 10 to 15% among women of reproductive age. There's no study that's inclusive of transgender men. So that's why I understand we don't live in a binary world, but a lot of these studies were only done in women, so that's what I'll refer to. Of course, transgender men can suffer from endometriosis as well. Endometriosis peaks in prevalence about age 25 to 35, although with increasing awareness of the disease, these patients are presenting at earlier ages, as early as adolescence. Now, the current gold standard for diagnosis of endometriosis is diagnostic laparoscopy, but that really represents a barrier to early recognition and treatment. Even this type of diagnostic tool is not perfect. Number one, it's an invasive procedure, though it is outpatient, still involves anesthesia. Two, it is not always accurate. And three, it can miss the disease. Now, endometriosis is a disease of contrast. What that means is that it's benign, but it is invasive and can have distant metastasis. And I'll get into that a little bit more in 60 seconds. If we look at the rates of diagnosis of endometriosis ethnically, compared to white women, Black, Hispanic, and Asian women were overall less likely to be diagnosed with endometriosis, though the rate in Asian women were much higher than Black and Hispanic or Latinx, according to a systemic review that was published in 2021. There's not much literature looking at the influence of race and ethnicity on symptomatology, treatment access, et cetera, but it may influence one's ability to access healthcare, obtain appropriate management for endometriosis through a combination of socioeconomic factors, implicit bias, presenting symptomatology, and ability to diagnose, and genetic influences. Now, during my residency, and I will not tell you when that was, but it was years and years and years ago. We were told, and our textbooks also said, that endometriosis was a white woman's disease, white women's disease. Those were the only people that got endometriosis. Well, throughout the years, we learned that that isn't true. And it wasn't until 2018 that the major gynecology textbooks said that endometriosis could occur in any women, any color woman. Now, that may tell us that maybe we shouldn't be looking at biases and differences based on color of skin. That generally has nothing to do with disease. But if we look at genetics, we can get more meaningful data and information. There's a retrospective cohort that was done in 2021 using electronic health records, estimated that 70% of patients diagnosed with endometriosis were white, 6% Hispanic, 9% Asian, and 4.7% non-Hispanic Black. On the other hand, in women presenting with infertility, there was no meaningful difference in endometriosis rates between Black or white women. So imagine that. Imagine that. One thing I do want to share with you, and I am struggling with this, but that's okay. This too shall pass. Endometriosis is now considered a systemic disease rather than a disease of the pelvis. So we have to, we have to look at it in a different way. Endometriosis affects metabolism in the liver and adipose tissue. Endometriosis leads to systemic inflammation and alters gene expression in the brain, leading to pain hypersensitization and mood disorders. Anxiety, depression are very common in these patients. Now, some of the factors that are important in the systemic presence of disease is that there is a presence of pro-inflammatory cytokines, pro-inflammatory cells, and shifts in the immune cell populations that cause inflammation outside the pelvis. Circulating substances called microRNAs have been found in abundance in women with endometriosis. And now these microRNAs are non-coding RNAs, but they can locally modulate gene expression throughout the body. Data from animal models have shown that cells from endometriosis can migrate into other organs, including lungs, liver, spleen, and brain. I was actually consulted years ago on a 35-year-old who had a mass in her lungs, and they biopsied it and found it was an endometrioma. And I was consulted to guide treatment in that. So endometriosis is a systemic disease, and we really do have to remember that. The signs and symptoms of endometriosis, the most common, of course, is dysmenorrhea. It's not just typical. Dysmenorrhea means common menstrual cramps. It's not the typical common menstrual cramp. It is worsening dysmenorrhea and pain developing at non-menstrual times of the month. And that makes it really, really difficult. Up to 50% of women with infertility are diagnosed with endometriosis. Pain is a large component and factor of endometriosis, chronic pelvic, back, and abdominal pain. The degree of pain, although, is not really related to the severity of endometriosis. You can have small implants scattered throughout and have severe debilitating pain, or you can have implants all over the pelvis and elsewhere. And some women have not complained of pain, and it's only discovered when they're having surgery for another reason. But in 50 to 80% of women with pelvic pain, you can find endometriosis. But despite this high prevalence, the disease recognition is inadequate, and diagnosis time ranges from 4 to 11 years, with 65% of women being initially misdiagnosed. And the final symptom it's not the final symptom, but the one I wish to highlight is that endometriosis significantly affects patients' psychological, mental, and physiological, mental, and psychological health, and their social and economic participation. Many patients are on antidepressants, anti-anxiety, and even antipsychotic meds. So let's look at current treatment modalities. The two most commonly used are medical and surgical. Medical consists of, the main factors to consider in determining treatment are how severe are your signs and symptoms, and whether or not you hope to become pregnant. That's important because that guides what you can and cannot do in treating patients with endometriosis. Doctors typically recommend trying medical treatment first and then opting for surgery. Medical treatment essentially puts you in menopause, suppresses your sex hormones, which has side effects in that realm, which Dr. Leslie spoke about. Surgical treatments consist of ablation of the endometrial implants or aggressive surgery. And neither one of these modalities are adequate. Recurrence of pain was found to be about 53% in those who were surgically treated and 44% in those who had medical interventions. So the treatment is mediocre at best. The best treatment for endometriosis is something that will relieve the pain, treat other symptoms, and not affect fertility. And this is where cannabis can be far superior to what we have now. Let's look at the endocannabinoid system, because that's where everything starts, right? The theory of clinical endocannabinoid deficiency suggests that the body doesn't produce enough endocannabinoids or enough receptors for the endocannabinoid system to function properly. And then as a result of that, it means that many functions in which the endocannabinoid system is involved, and that is a whole lot, aren't regulated properly. The body becomes unbalanced, allowing disease to arise. This theory was proposed by Dr. Ethan Russo in 2008 and then revisited in 2016. There are 4 tenets to the condition. The first is that there's an increased sensitivity to pain called hyperalgesia. Hyperalgesia is, as I said, an increased sensitivity to pain and an extreme response to pain. People with endometriosis are commonly hypersensitive to pain, and this is because of central pain sensitization. And what that's about is when I talked about those substances called the microRNAs, well, they act in the regions of the brain associated with pain perception and cause the hyperalgesia. Secondly, all the conditions in this category are usually diagnosed subjectively by a process of exclusion. There being no or extremely limited, without major intervention, objective tissue or lab findings that are diagnostic. Endometriosis does not have pathognomonic signs and symptoms that are specific for the disease. Instead, the disease has symptoms that are common to other gynecological and non-gynecological disorders: primary dysmenorrhea, ovarian cysts, pelvic inflammatory disease, pelvic adhesions commonly are overlap with or can be called endometriosis, or endometriosis can be called pelvic adhesions. Pelvic pain in relation to uterine fibroids is also a possibility, and some functional disorders of the bowel and bladder can have similar symptoms, including fibromyalgia. Third tenet is all the diseases in this that fit this theory are associated with a higher instance of anxiety or depression. Again, this is caused by the altered gene expression in the region of the brain associated with anxiety and depression. And finally, number 4, they often overlap with patients presenting with some combination of similar conditions, meaning other conditions that can be considered clinical endocannabinoid deficiency, including PTSD, MS, autism, functional disorders of the bowel and bladder, and fibromyalgia. Now, I'm going to go through a few delivery methods for cannabis. We all did agree to talk about something that was basic so you can have an understanding about these things. Cannabis treatment in endometriosis is a multifactorial program. And if you're going to use cannabis should be a part of it. Now, cannabis by inhalation, rapid onset, shorter duration than the other methods, but it's very easy to diagnose. Joint vape pens, vaporizers are an example, but vaporization is much better than the others. Vape pens I tend to shy away from, but there are some people that do well with vape pens. So I don't poo-poo it totally, it's just not my first line of defense. Ingestion, that means edibles, gel caps, capsules. That takes a little longer, maybe 60 to 120 minutes. The peak effect is in a couple of hours. Duration, it can last up to 10 hours. That's why it's also a very helpful modality, but it's very difficult to dose. You got to start small, start low, go slow. The other concern about the ingestible methods is that THC is changed to a stronger compound when eaten. A very small amount can be very potent. And people who like the inhalation method often don't like the ingestion, the way the ingesting cannabis feels. It's a different type of psychoactivity, impairment, or intoxication. There are a couple of levels. Sublingual route is somewhere in between the inhalation and ingestion. The onset is about 20 to 45 minutes. It peaks in about 60 to 90 and can last up to 6 hours. Those are your tinctures, your sprays, and your extracts. Those are convenient because there's no odor, there's no equipment. No one even knows you're medicating. That can be very effective. And there are many people who don't want to use the inhalation method. This is a nice second option. And I don't want to leave out topicals because believe me, the older you get, the more you're going to love topicals. It's for external use only. There is no systemic absorption, so no risk of impairment. You can apply it to joints, muscle soreness areas. Works wonderful and lasts a couple of hours. Can also be used on rashes, eczema, and psoriasis, but don't use on open wounds. We haven't really done a lot of pharmacological studies on the duration and the onset of action and whatnot of topicals. Depends on absorption in that local area, but topicals are very valuable, particularly for athletes and as one ages and has the joy of aches and pains of aging. Now, I need to talk about suppositories because if we're going to talk about endometriosis, suppositories are just wonderful to use, vaginally preferred, but people do use rectal suppositories. The absorption is passive. We don't know the absorption rates. It's unknown. For rectal suppositories, the THC is absorbed if it has a chemical attachment called hemisuccinate. You don't need to remember that name, but it is very important to know that if you make a suppository and put THC and CBD and terpenes and whatnot in them, if you use it in the rectum, you're not going to get much absorption of your THC unless that chemical attachment is there. For suppositories, you want to titrate the dose gradually. You can use any of the cannabinoids or terpenes. Oil-based suppositories are okay. Now, the vaginal suppositories are, again, the vagina is like a sponge when it comes to absorption. So you have to be real careful. THC is absorbed through the vagina. Now, the effects of cannabis depends on the dose, the ratio, the route of administration, the timing after administration, the health status of the patient, the age of the patient, and use of other meds, cannabis naive or cannabis experienced. All of those factors have to be taken into account. And I would say to anyone who wants to use cannabis to treat their conditions and whatnot, please see a cannabis clinician and get some really good advice. That can be a cannabis coach, a cannabis physician, but there are plenty of knowledgeable people. Don't just depend on friends and family who've used it as an adult use method. Sure, they know a lot about it and they know how it works for them, but how cannabis is going to affect you is really based on you, your individual endocannabinoid ohm and your endocannabinoid tone and all the other things I just mentioned. Final points. We are a spirit that has a soul that lives in the body. Cannabis should be used in a holistic approach. If you're really ill and you want to use cannabis to help, do some other things as well, such as clean up your nutrition, breathe fresh air, drink water, all the things my colleagues have said. Be willing to use different modes of delivery in the same patient. That's called layering. Sometimes patients will use edibles or tinctures, and then for breakthrough symptoms, use inhalation. It all works really well, nicely together. If you're going to use cannabis in women, you want to counsel them about cannabis in pregnancy. Now, I have views on that, but we can't get into that right now. Know that cannabis does not work for everybody. Set and setting has a large influence on how cannabis can be effective for you besides all the other things I mentioned. We have a lot of tools that can be used to help us with our chronic diseases, whether the symptoms be pain or what have you. But get good help. Join Doctors for Cannabis Regulation, Marijuana Matters, the Society of Cannabis Clinicians, and ACAM. You can learn a lot there, and you can find good physicians that can help you. Don't be afraid of that. Thank you. There's how you can reach me, my website, etc. Thank you.
So the first question, and perhaps this was already answered, but maybe we can have someone, either of our presenters, answer this question in a really break it down in a kindergarten kind of way. Can one of you explain the endocannabinoid system for those of us who are just not aware?
I have the quick one. Relax, eat, sleep, protect, and forget. So those are 5 essential functions that your body makes. 3 things. It makes the endocannabinoid itself. It has receptors, and then there's enzymes that either build up the process or work to break it down when you don't need to be eating anymore. So it's an inborn system. You have it all the time. Squirrels have this, monkeys have this. We all mammals have an endocannabinoid system, and if everything's balanced, then you sleep at the right time, you eat at the right time, you can defend yourself from diseases. So it's a system that is in every single cell with receptors in the brain, in the immune system. Mostly you have CB1 receptors in the brain where you're going to have more effects, for instance, from THC. I mean, it is a whole other course. But that's my quick explanation of the endocannabinoid system.
Can I just say one thing?
Please do chime in.
Okay, and that was a great explanation. I just wanted to add that the endocannabinoid system, yes, is genetically determined, but it's also determined, it can be enhanced through the environment, through what you eat, what you do, and your physical activity. There are certain foods that will enhance your endocannabinoid system. Exercise elevates your endocannabinoids. And so there are a lot of things that one can do. And you know, when your clinicians advise you to exercise, there are some benefits to it. It's not that, oh no, I gotta exercise, but it's exercise is important, and it really does help your endocannabinoid system. For sure.
The endocannabinoid system is responsible for homeostasis in our body. So what does that mean for our non-clinicians? That means that it regulates all those systems that Dr. Mendoza was mentioning: sleep, hunger, feeling satisfied and happy, or the lack thereof. So the immune system. I often tell patients cannabis sounds like snake oil because it does so many things. But the reason is truly because we have an entire system in our body that's hardwired to produce these chemicals on demand in the tissues that it's needed and then break them down. So this is an entire system that physicians don't even know about. And we really need to educate our clinicians and now our patients too. So I'm glad that we can bring you all along and enhance our cannabinoid system, because we'll all be happier and healthier.
Sorry, Dr. Jones here. I want to jump in and co-sign everything and add 2 more things. That's okay. In addition to everything that was already said, don't forget we have natural body states of ease and disease. So if you have a disease state, a particular one, you may either what they call upregulate or downregulate your endocannabinoid system. So your body's current state can also affect how well or not so well your endocannabinoid system is working. And of course, finally, don't forget your genetics plays a huge role.
Wow. Thank you so much for that information. We have two questions that kind of go together, and I know that they were, again, loosely touched on, but for those of you who can answer, the two questions are, what are your thoughts about vaginal suppositories for cramps, low THC and high CBD? And the sister question is, how do cannabis suppositories distribute throughout the body? Does this method address endometriosis and pain more effectively? So whoever would like to go.
Sure, I'll take that,
Go ahead,
especially
Dennis.
since I did mention using, excuse me, suppositories in the treatment of endometriosis. And as I mentioned, we really don't have any information on the pharmacodynamics of suppositories, but you won't get absorption of THC through the rectum unless it's made with a hemisuccinate portion. I know that patients can make suppositories. I actually have some patients make suppositories, but they're for the vagina to absorb CBD, THC, absorb the whole plant. Through the rectum, you won't absorb THC, but you'll absorb some of the others. And both of these will bypass the liver, so you don't get the THC turned into that more potent compound. You'll get the feeling that's similar to what you would get with inhalation. Suppositories are effective, both rectal and vaginal. I would, again, start low dose, especially if you're going to use the vagina. And I would use the vagina if you have one, for sure. But because the THC does absorb very well and very easily. The vagina, I do a lot of hormone therapy, and some of my patients prefer just put a little troche in the vagina and you're good to go all day. It absorbs 99.9%. So whereas orally I might use 1.5 or 2 milligrams, vaginally it'll be 0.2 or 0.5 milligrams. So that's how the difference in the doses there are because of the high absorption of the vagina. And it can be very effective for pelvic pain as well as other pain.
And I have found suppositories, they're not easy to find. When you actually go to a dispensary and you want some, usually in Illinois, they're like, we don't have them. When are you going to get them? We don't know. And so one of the challenges, big, huge challenge, I think probably many places, is you find something you like, you go back to the dispensary and they don't have it anymore. And I find that suppositories have actually and I have no magic formulas. That's, like I said before, what a 1-to-1 formula might work well for someone, but another person might need high THC, low CBD. You don't know until you try it. And it's an expensive experiment. So I've asked patients, and I have one who's really doing this, where she takes RSO oil, so it's pretty high THC, dilutes it with CBD hemp oil, and puts it with coconut oil, and then puts it in a little Amazon, like one of those silicone suppository trays you can order online, refrigerates them, and then puts that inside vaginally, because it's a much cheaper way to get your suppositories, and then you can experiment with your own formulas and ratios. But it does require the patient to do a bit of experimenting. And how you get people started, I always, again, low THC, just to make sure you can counter for any potential intoxication effect, high CBD ratio, maybe a 10-to-1, like 1 drop of THC, pure THC, and 10 drops of CBD only hemp oil mixed in with some coconut oil. And then you take a toothpick and mix it in the suppository tray and then give it a whirl. Write down what you think, what time you started it, when you started to feel the effect, what you felt. And if nothing really happened, then the next one you make something stronger. So that really, from a actual how do you do it point of view, I think that could be helpful.
Yeah, and one other thing about those suppositories, if you're using them vaginally, First of all, that was a great description, Dr. Leslie Mendoza Temple. The oil in the vagina is not a good combination for the long haul because it can eventually make your vagina a little lean towards the drier side. You want a water soluble base, but that's very difficult to find and you won't be able to make your own. There is a company, they were at the ACNA conference that is attempting to come up with suppositories that can work. And I am going to stay in touch with them. And if anybody wants to know anything, any other thing about them, just shoot me an email and I'll let you know.
Yeah, because it has to be solid when it goes in. And so I'm not sure.
Exactly. There's a way it can be done. It's tough.
Yeah,
It's tough.
Soluble ice maybe, and then you put that in, then it will melt, but then it makes a mess. So, thinking of the practicalities of it, I'd love to hear what your how you solidify a water soluble thing.
Are you saying that the oil-based suppository can be absorbed through the vagina, but it's just not ideal because it causes dryness?
Correct. And also, if you're going to use a patient with endometriosis has pelvic pain, so they're using the suppository to relieve their pelvic pain. But then if you have sex and there's a condom used, the oil will destroy the condom. So that won't be an effective method of contraception. And also, but yes, oils do clog the glands and decrease the moisture, make the vagina less moist. So it can make sex difficult from that perspective over the long haul. I'm sure using it once or twice a month is not going to be a major problem, but we need to find something that's water soluble.
And one more
no, I
question.
don't know the procedure or anything like that. I'm just learning about that. I want to see what that's about as well.
Another question. I understand what you're saying, that when you insert a suppository, the absorption rate is much higher. Is it because of the delivery method, or is it because of the location that's a good idea for pelvic discomfort? I guess my question is, because you're inserting a suppository into the vagina, is it staying more local in those tissues, or is it getting systemically absorbed, but a better absorption rate because it's not going through the liver?
We don't have studies looking at the pharmacodynamics of suppositories. That would be great information to know. But talking to patients clinically, they seem to get relief, certainly get relief in the pelvis area. But since the absorption is systemic, you can get relief for other areas of the body as well. But that's just in talking to patients.
Yeah, everything that we're learning is from our patients that try.
Yeah, exactly.
So, 10 years from now, we have better answers.
Right.
All kinds of studies we could be doing based on this, water versus oil versus.
Right.
I have patients who use, like Carlson's makes a nice vitamin E suppository, but it's got oil in it. So it's kind of like lotioning up the dry skin inside. I have patients who've been on it for a long time and they don't seem to be bothered. I'm going to throw in omega-7 fatty acids have actually been one of our little secrets that it's from sea buckthorn. I know I'm off the cannabis topic, but we've had some nice anecdotal response from our patients who've had breast cancer and they can't do hormones and they have vaginal dryness. They don't want to do any estrogen at all, even though the oncologist says it's okay, you can do twice a week. They're like, no estrogen, but they're miserable and having recurrent UTIs. So trying that is a nice option as well. Sea buckthorn, which has omega-7 fatty acids.
Wow. I'm looking at the chat and I also love what's happening here. I think that some of our participants are helping to solve one another's questions too in real time. Just a quick request of Dr. Jen Nestor Wilson King, someone had asked if you would mind repeating the additional resources and organizations you mentioned. So if you would be so kind as to put those in the chat, that would be great. My next question, and I think we have time for maybe 2 more. So I am going to go with, this is an interesting one. Would CBD interact with people taking cholesterol lowering drugs, for example, Lipitor?
They do share the same enzymes in the liver, but as I mentioned in my talk, you know, if it's under 1,500 milligrams a day, is very unlikely that you're going to get any interaction. So I think you're safe to try it.
I would agree. I haven't seen anyone have any issues with that so far.
I too would agree with that. One of the things I suggest to patients is always take your cannabis 4 hours before or after taking another medication, and then you won't have to worry so much about the interaction, because the one medication has already been metabolized before the other medication that is metabolized through the same cytochrome system. So there won't be an interaction 4 hours before and after. That's important too.
Can I add? In my experience, 4 hours may be a little safe. I use 2 hours as a recommendation, and also a lot of times only 1 or 2 kind of chances will, if you don't have a reaction like right away, or that first time or second time you use it, you probably aren't going to. And I think one of the other doctors mentioned that you need to get to a certain critical mass dose of 1,500 milligrams before you really see anything. And most people can't afford to take that much, nor do they need to. So yes, be safe, be cautious, but may not have to be so tight.
It's the say 4 and you get 2 mode of operation.
Yes. Good point.
Just like when patients tell you they smoke a half a pack a day, they probably smoke a pack. So that's why I give it 4, because I know I'm going to get 2.
All right, so we've got one more brief question before I close us out. Can cannabis lotion be applied directly to the genital area in women to increase sexual responsiveness?
Well, if the lotion is described as a topical, that means you should not put it on the mucous membranes in general. That's how I would address that. You can find a different way to apply the testosterone, the cannabis to help with sex. Actually, inhalation method works real well. A lot of that one survey that Dr. Leslie was talking about was the one with this survey that people who used cannabis to enhance sex, and that they said inhalation just before having sex works wonders. So I don't think you even need to apply it to the genitals to enhance sex.
I would think that you might actually have burning, and so you would probably find out pretty quickly whether it's working or not. But I agree that they also used edibles, and so also the dose matters. If there's 4 joints or more smoked, it actually had sedating and sexual inhibition effects. So the dose is important.
I have a question regarding that. Are we treating the sexual organ of the brain, or are we actually treating the genitals?
Connected.
That's a great question. That's a great question. Again, like I said, it was just a survey. So we haven't really delved into the what's going on, where is it dispersing, and where is it really affecting and helping in the sexual experience. So that's a great question.
For women, it's often more in the mind than in the body, you know.
Amen.
The mind's got to be there to get the arousal thing going there. And, a lot of women like the oral because you get the conversion to the 11-hydroxy in the liver, which is much more intense and gives you a more intense sexual experience.
Yeah,
There you
exactly.
go.
The edibles tend to have a better effect. I have lots of patients talking to me about that. And I think the question would use the phrase lotion. Lotion is the operative word. That's the problem. A lot of products are made for I guess intercourse with the water soluble gels and mostly CBD. And some, I guess, some oils too. But there's plenty of products out there. How about you just have fun trying them?
Awesome. Well, I cannot thank our esteemed panelists and doctors enough. Happy Women's Health Month. I have personally learned so much about my own self on this call, taking many, many notes. I want to invite everyone to check out our work at DFCR and at Marijuana Matters. Thank you so much for co-hosting this. There are multiple ways that you can support if you go to each website, so DFCR and Marijuana Matters. You can donate. Your donations help us to be able to put on webinars like this and to get out useful information. And so we will make sure that you all have a link to donate in the future. This call was recorded, so it will be available for replay on YouTube, and you all will be receiving an email with the follow-up information after that. So thank you all so much, and have a wonderful night Googling and clicking links and researching about all of the amazing things that we can do, particularly as women, to support our health using cannabis.